it's not a metabolic syndrome, obviously.
What's the craziest shit that you've seen with gear?
Some of the craziest had a little bit more to do with the quantities, but also just duration, gram dosages. I think people need like 200-300 IUs of Lantus to, control their blood glucose. Glucose of 200 with, I want to say, upwards of 100 to 200 IUs of Lantus still. There should never be a scenario where you need that unless you're, extremely diabetic, and especially not post-contest when you should be pretty insulin sensitive. A lot of the long-term issues are probably going to revolve around this metabolic syndrome type of scenario where it's
when you have blood glucose level at 200 and it cannot be addressed with the insulin injection, it's obviously something else. And what we have here is the typical less known and not so frequently diagnosed insulin autoimmunity syndrome. So he needs to address that. He might be injecting how much he wants. It's not going to work. He ruined his life with insulin injection, essentially. So this is what happens. People don't know about this, but this is what happens. Every insulin user risks this condition.
Insulin autoimmune syndrome, EAS, is a rare condition characterized by the presence of autoantibodies against insulin. This condition can be instigated by the use of certain medication and insulin injections, or on the background of genetic predisposition and other autoimmune conditions. The symptoms are hyperglycemia and hypoglycemia. The insulin is not a 100% pure insulin, which may elicit the immune response, acting as the adjuvants. That is the factors that establish and enhance the immunity to the injected substances, in this case the insulin. Although it has the human blueprint and structure, the antibodies then bind insulin and form complexes, which can result in hyperglycemia, high blood sugar after meals. Over time, the insulin is released unpredictably, resulting in hypoglycemia, low blood sugar, as large amounts of insulin are released all at once. However, it's a rare side effect, and most people on insulin therapy do not experience it. This is more common in individuals with autoimmune diseases or those genetically predisposed, especially those of East Asian descent. Drugs containing sulfhydryl groups, such as methimazole, an anti-thyroid medication, have been linked to the development of insulin autoantibodies. In my research, I have seen some anecdotal reports that certain beta blockers can exacerbate such a condition. And as it is a trend now for bodybuilders to use beta blockers constantly daily, this condition may easily develop in certain individuals. Hypoglycemia is the most common symptom. However, I would assume that the frequent feeding and carbs consumption may neutralize the potential hypoglycemic episode, and thus the hyperglycemia would remain and be the primary symptom. Diagnosis involves detecting high levels of insulin autoantibodies in the blood. Hypoglycemia during fasting. A test where blood sugar and insulin levels are monitored to see if the hypoglycemia occurs during fasting or post-meal. The latter may indicate the syndrome. However, it is safe to assume that any insulin user with such symptoms, or who experiences a diminishing effect of the insulin injections in time, is due for IAS tests. Treatment. If insulin autoantibodies are detected in a patient, healthcare providers may adjust the type of insulin, dosing regimen, or treatment strategy to better control blood glucose and reduce the risk of hypoglycemia. Frequent, small meals can help manage hypoglycemia by keeping blood sugar levels stable. IAS is typically transient and resolves on its own once the offending medication is discontinued, though persistent or severe cases may require more intensive management. In my view, a prolonged fasting for 2 to 3 days, or switching to carb-free diet for more than 1 week, may and will reset the immune system. However, it should be emphasized that any such changes must be done gradually and with the proper preparation, and with a doctor's supervision. Wish you health and happiness.